A 49-year-old man presents to the emergency department following multiple syncopal episodes. He has a past medical history of depression for which he is prescribed amitriptyline. His cardiovascular and respiratory examination is unremarkable. An ECG is performed. What is the diagnosis? The options are A. Pulmonary embolism, B. Long QT syndrome, C. Wolff-Parkinson-White syndrome, D. Hypertrophic cardiomyopathy, E. First-degree heart block. The answer is B. Long QT syndrome. The QT interval, measured from the onset of the initial wave of the QRS complex to where the T wave returns to the isoelectric baseline, is the ECG representation of ventricular depolarization and subsequent repolarization and may be measured in any lead in which it looks prolonged. The most commonly used formula to calculate the QTC is Buzet's formula, QT divided by the square root of the RR interval, where all intervals must be in seconds. The RR interval is the interval between each QRS complex and should ideally be that immediately preceding the QT interval and averaged for 3 to 5 complexes. QTC is prolonged if greater than 440 milliseconds in men or greater than 460 milliseconds in women. QTC more than 500 is associated with increased risk of Torsades de Pointes. A 30-year-old woman is brought to the emergency department by paramedics after blacking out on the London Underground. She recalls feeling warm and sweating before becoming lightheaded. She has no significant past medical history. You note a normal cardiorespiratory and neurological examination. Her observations are recorded as heart rate 94 beats minute, blood pressure 115 by 67 mmHg, respiratory rate 18 breaths minute. What is the most likely diagnosis? Options are A. Carotid sinus syndrome, B. Orthostatic hypertension, C. Cardiac arrhythmia, D. Vasovagal syncope, E. Seizure. The answer is D. Vasovagal syncope. Suspect an uncomplicated faint, uncomplicated vasovagal syncope, if there is an absence of features to suggest an alternative diagnosis. The presence of features suggestive of uncomplicated faint, the 3 Ps. Posture. Blackout occurred after prolonged standing. Similar episodes may have been prevented by lying down. Provoking factors, such as pain or a medical procedure. Prodromal symptoms, such as sweating or feeling warm-hot before the blackout occurred. A 79-year-old man presents to the emergency department after collapsing in a bus stop. He recalls standing up to board the bus before feeling lightheaded and experiencing tunnel vision. He tells you he has had several similar episodes over the last 6 months, mostly occurring in the morning while getting out of bed. He has a past medical history of hypertension for which he takes ramipril and amlodipine. Which of the following investigations would be most useful? Options are A. Blood glucose level, B. A full blood count, C. Lying and standing blood pressure, D. 12-lead ECG, E. 24-hour Holter monitor. The answer is C. Lying and standing blood pressure. Orthostatic hypertension is suggested by a typical history, lightheadedness, dizziness, weakness, tunnel vision. Symptoms should not occur while supine, should get worse on standing, and should be relieved by sitting or lying down. Some people may present with recurrent or unexplained falls. Symptoms are often worse early in the morning, in hot environments, after meals, after standing motionless, and after exercise. A 64-year-old man presents to the emergency department with a 2-hour history of central chest pain. His ECG shows ST elevation in leads 2nd and 3rd and AVF. He has a past medical history of peripheral vascular disease and poorly controlled type 2 diabetes. He is a current smoker. The nearest primary PCI center, PPCI, is a 3-hour transfer away. Which of the following management plans is most appropriate? Options are A. Aspirin 300 mg stat and emergency transfer for PPCI. B. Aspirin 300 mg stat and low molecular weight heparin. C. Aspirin 300 mg stat and fibrinolysis. D. Aspirin 300 mg stat and clopidogrel 300 mg. E. Aspirin 300 mg stat and angiography within 96 hours. The answer is C. Aspirin 300 mg stat and fibrinolysis. Offer fibrinolysis to people with acute STEMI presenting within 12 hours of onset of symptoms if primary PCI cannot be delivered within 120 minutes of the time when fibrinolysis could have been given.